The National Department of Health says it is concerned about the increase in the number of Mpox confirmed cases. It says countries like the DRC started with few numbers and are now ranging at 7,000. The department has called on all citizens to join hands with government and curb the spread of the Mpox virus. Yesterday, the department confirmed another Mpox-related death, bringing the total number of deaths to 3. South Africa has recorded a total of 16 Mpox cases. Dr. Jacqueline Weyer, head of a Center for Emerging Zoonotic and Parasitic Diseases at the National Institute for Communicable Diseases, joins us now. Thank you so much for your time. Just talk to us about this recent case. I mean, how worried should we be in as far as this is concerned? I mean, one of the top things that people are concerned about is the fact that is there, a proper tracking of these cases that are being reported by the Department of Health?
Yes, so contact tracing or tracking of the cases have been really difficult. I think the circumstances of the cases are contributing to that. Mpox is a disease that is transmitted through close skin-to-skin contact, and in most instances, sexual contact. So we are seeing that cases are reluctant to share certain personal information, which one can understand. And similar challenges have been seen around the world where Mpox have been reported during the multi-country outbreak. So contact tracing is underway, but it is not ideal. And teams on the ground are having to find or try to find different sources of information to try and make the contact tracing process as successful as possible. We are worried about the outbreak in the sense that the severe cases that we are seeing are mainly affecting unmanaged HIV patients. And this is in a country where HIV testing is readily available, where antiretroviral treatment is available. So it's actually quite a sad state of affairs that we are seeing these severe cases of Mpox because of people not seeking treatment for HIV infection.
And you briefly touched, Doctor, on how the disease is transmitted. Perhaps just talk a little bit about that and what should people look out for in as far as first indicators of having this disease.
So it's not a highly transmissible disease. It's not at all the same as something like the flu, which we are dealing with now, or COVID-19. That spreads through the respiratory route. So it's not very transmissible. It transmits through direct contact, skin-to-skin contact, as a matter of fact. So people that are affected with Mpox will develop a skin rash, and the virus resides within these lesions that form part of the rash. And direct contact with those lesions results in possible exposure and transmission of the virus. So the onus is really on people that develop a skin rash, which might be in keeping with an Mpox diagnosis, to seek medical advice. There's also many other causes of rash, both infectious, non-infectious causes. So look after your health, visit your healthcare provider and let your condition be checked out. If it's Mpox, there are a treatment available for cases that are at risk of severe Mpox or cases that have already developed to present in a more severe fashion. But if it's something else, then there's in some instances also different ways that can be managed. So we're urging the public to take care of their health and get checked out if there's any signs or symptoms that may be associated with Mpox.
And some of these symptoms, we hear of, they sound incredibly painful. I mean, we are told of these lesions being everywhere in the body, hands, bottom of the feet, in the groin area. everywhere essentially, and lymph nodes swelling and so on. To what extent then, just talking about the number of people that have succumbed to this disease from the first time of, being infected to showing these symptoms, how dangerous then is that period?
So the most prominent feature of Mpox is definitely the skin rash. The lesions can be quite painful. Takes about 2 to 4 weeks, depending on the severity of that particular case, for those skin lesions to resolve and for the skin to heal. In some instances, what we've seen during the multi-country outbreak is that patients are actually hospitalized specifically for pain management and not necessarily for anything else, but to manage the pain. So especially in your more severe cases where there's more lesions and where these lesions
All right, we seem to have lost Dr. Jacqueline Weyer there, of course. She's the head of the Center for Emerging Zoonotic at the National Institute of Communicable Diseases, just talking there around the Mpox disease. And of course, we will continue to monitor this development. Dr. Weyer, I believe you are back with us. You were just finalizing, the conversation around, when it is actually quite serious for this disease and when treatment should immediately commence.
Absolutely. So in most cases, the disease will be fairly mild. Patients will not need any specific medical intervention, but what we are seeing in immunocompromised individuals or individuals struggling with other comorbidities, that they might need more support. They might have more disseminated lesions, which might require pain management or also other symptomatic support.
And just in terms of the vaccine, very quickly, Doc, as we wrap our conversation, how have you seen the uptick in this, and what is the process there for the vaccine around the Mpox?
Yes, so there has been a strategy developed for the use of Mpox vaccines in South Africa, and teams are currently working to see how best to secure stock of Mpox vaccines for South Africa. So the coming days and weeks will be interesting to see how that comes online. So definitely a prospect for South Africa, and teams are working really hard to secure access to vaccines for the country.